My name is Antony Tutor. I'm 46 years old and I live with chronic pain in my kidneys, urinary tract, joints and jaw. I've lived with pain for 26 years. My pain began with me experiencing back pain and pain in my flank. Nobody knew what was going on. It turned out I had renal colic, but I didn't have normal renal colic. I was making stones all the time and gravel and sludge, and I still do. Um, and that causes pain in my kidneys and urinary tract, and I get what's called visceral pain from that, which is rather unpleasant. Then in my 30s, I started to develop joint pain in my feet and in my hands, and gradually it's affected pretty much all my joints and my back. And then also in my 30s, I had some dental work done, and the dentist damaged a nerve in my face, and I now have a constant ache here. And I have roving toothache, so it's called orofacial migraine. So I get some migraine symptoms. I feel drunk sometimes. I feel like I'm slurring my words. I can't think, and then I have this toothache and this aching pain here. So yeah, joint pain, dental pain, and kidney pain. I've kind of got the lot. I didn't really know much about pain before I was diagnosed. I used to, it was like most people, in that you hurt yourself or something goes wrong or you have an operation and you get better and the pain goes away. And of course, the hard thing with chronic pain is it doesn't go away, and you have to live with the devastating realization that it's not going away and you've got it forever. And it's the loss of hope that's the worst part. Three words that come to mind when I think about pain, in fact, sorry, it's not going to be three, is isolation, feeling alone, not feeling believed, depression, anxiety comes with pain, and they're a daily struggle. And just sheer exhaustion. Pain is really draining. It makes you so tired, and it makes it really hard to get going and to do anything. So I have to push myself really hard to do the stuff I do. When I was first diagnosed with chronic pain, or first developed chronic pain, my life really fell apart. I went from holding down a job and climbing mountains and sailing and living a very active life with my then partner to it put pressure on the relationship. He didn't know how to cope with the changes in me. I didn't know how to cope with the changes in me. It caused problems at work because I needed more and more time off work, and eventually I was signed off work permanently and I lost my job. And then eventually the relationship collapsed, and in doing so I had to move out and I didn't have a home anymore. I lost my home. That was a devastating time, absolutely devastating time, and it's taken a long time to recover from that. It led to a 10-year period of deep depression and anxiety and not coping and just complete loss of hope and a feeling that life was never going to change or get better. Yes, there was the experience of a pain doctor who stuck a needle in me, and it was quite a long procedure. And after he'd done the procedure, he came back to me and said, "Are you in pain, Mr. Tutor?" And I said, "Yes." And he said, "Well, it didn't work then." And I felt like a failure. I felt like an experiment had gone wrong. And the success was doing the expert patient program that really helped me come back to life. Um, my partner really helps me manage my pain. He supports me enormously. The things that I wish were different when my pain had started was I wish my GP had access to someone who could really psychologically support me and understood pain. I had to seek my own counselling, and it wasn't very good. It didn't really help me come to terms with living with pain. I did that years later. it would have been really helpful if my GP had access to a pain clinic and could talk to a pain specialist on the phone and get advice and actually manage me in the community, not put me on some waiting list, which takes 6 months to see the specialist and then another 3 months to get on the pain management course because it's so full. I think that, and maybe having a pain physio in the community and a pain occupational therapist, so that those three things, the occupational therapist and the physiotherapist and the psychologist, were all in the community to help people who live with pain. That would be the three things that I would have changed, and would have maybe helped me keep my job. Currently, I manage my pain with a lot of self-management. I take a medication that is for epilepsy as well as for chronic pain that helps dumb down my pain system so that the pain signals don't get transmitted so well, and that helps a lot. And I use opioid medication on really bad days, but they're very, it's really for breakthrough pain, and I only use opioids for a day or so at a time, which is what they're there for. I use a lot of self-management with my pain, and also I've got a very supportive partner, and I couldn't do everything I do without him. Having support around you is really important. I no longer take strong opioid medication every day, I just use it occasionally. I pace myself now, I use self-management techniques. I didn't used to do all of that. I used to really expect doctors to fix me, and of course they can't just fix you. They have to work with you to try and solve this problem together. I've got a great GP, and that's a huge help, having a really good GP. And I'd say if you don't have a good GP, go and find one. There's lots of them out there. You've just got to change practice maybe, but finding a good GP really helped me. And get support, have friends, family, try and get them to understand what you're going through. My advice to anyone who lives with pain is be kind to yourself. Don't push yourself too hard. Don't beat yourself up. It's so easy to do. Do what you can do every day, and don't sweat the small stuff. Get a good GP. Having a good GP, having good support around you is really important. Do some voluntary work. Voluntary work really helped me. I'm still volunteering now. It makes me feel good. It makes me feel better about myself. It gets me out. It gets me to meet people. And even if you can't do much, it's really helpful. And to those caring for people with pain, you're doing a great job. Thank you. Be kind. Be generous to them. They may not always look like they're doing their best, but really they're doing what they can on that day. And thank you for caring for them.
To support Pain UK, please like Pain UK on Facebook, subscribe to their YouTube channel, which is Pain UK TV, sign up to become a member at Pain UK, or donate to Pain UK. All relative links can be found on Pain UK's website, which is www.painuk.org.